just a cold fall day here in Michigan.
I know.
Like, who would have thought?
What is it? 66.
It's actually summer, yeah.
Yeah.
June 23rd. Oh, hi.
Hello and welcome to another episode of Wednesday Wellness.
Wednesday. Let me try. Hey, everybody.
Hey. We're usually doing karate chops because we're standing up.
Yes. Hi. It's Wednesday. It's wellness.
It's Wednesday Wellness.
It's Rise Wednesday Wellness.
We're Rise Wellness Chiropractic.
Yeah.
We're talking wellness on a Wednesday.
Wellness on a Wednesday with our tea.
Yep.
Okay. What are we chatting about today?
Today we're talking about some pretty serious things, which is why we had to sit down on the couch to chat with you guys today. We're talking about, what else did I write on there? What sleep issues, ADHD, constipation, colic, reflux.
I mean, think of any issue, sensory, anything your kiddo might be dealing with, your baby might be dealing with.
Yeah.
Have in common.
What do they all have in common? Not just that kids have them.
Yeah, adults can have them also, yeah.
Yeah.
But
They're,
it's probably like a neurosensory processing problem.
exactly.
Yeah.
That's what they all have in common. They all live in your nervous system.
Yeah. I bet people don't know that chiropractors are actually nervous system doctors.
Mm-hmm.
It's actually what, if you come here, you know that. We talk about the nervous system.
We talk about it a bunch.
Yeah.
If you watched our videos.
Yeah, if you watch our videos, you know that the nervous system controls everything, master system of the body. There's two parts of the nervous system, sympathetic, parasympathetic.
Yep.
Sympathetic.
And that's all the automatic stuff that we don't think about.
Yeah, sympathetics are fight or flight. Hey, I'm going to run away. Hey, my body's not worried about
you probably heard
healing.
Yeah. You probably heard us refer to it as like your gas pedal.
Oh, yes. Sympathetics are gas pedal. Like, it's like really just in survival mode.
Totally.
Right, we're just worried about survival. Our body's not worried about digesting any food we might have just eaten.
It's not worried about our immune system.
Not worried about
long-term effects.
Not worried about healing and repairing.
No, because if a tiger's
Sleeping.
chasing after you, you're not worried about getting a cold or
Mm.
COVID.
Who's caught a cold lately? Anybody? Took your mask off, got a cold? Might have happened.
It's going around.
It's going around,
Yeah.
So, yeah, sympathetic. And then our parasympathetic is really our...
It's the brake pedal.
It's the brake pedal.
Slow down, rest, digest, sleep, grow, rebuild our tissues, all that kind of stuff. Yeah, growth. That is a big one.
Growth, yes.
For kiddos.
Kiddos should always be in growth.
Yeah. And repairing.
Yeah, like a newborn baby should be like the ideal symbol of our parasympathetic nervous system.
Yeah.
What's going on, right?
Eat, sleep,
poop. So we say babies should be doing eat, sleep, poop. If they're having any trouble with that, well then we know there's an issue going on in their autonomic nervous system for that gas pedal.
Yeah.
That we stuck.
Yeah.
Sympathetic.
And all that starts with pregnancy.
Yeah.
Mom stressed out during pregnancy, like, the past 2 years, probably. I mean, we see a lot of COVID babies, and we've talked a lot about that in previous videos. But the COVID babies are that way because of stress during pregnancy and stuff. If mom's gas pedal is going, then that baby is born with their gas pedal going.
Yeah, so that's, so stress in pregnancy, everyone had it, Like everyone was scared, everyone we saw in here, like in the beginning of COVID was scared to come in when pregnant, they're scared
Most of
of
our
COVID.
moms were buying new houses. And
Scared to go to the hospital and have a baby, then trying for a home, just scared and stressed out and didn't know what to do.
Yep.
But even without COVID, I mean, there's stress in pregnancy, whether it was like infertility or IVF treatments, or you got pregnant when you weren't planning on it, and the finances of it.
Yeah. Or you've been trying for a long time.
Yeah. I know I had twins, most people know that. That was super stressful when I found that out, and I know I had a lot of stress during that time. So, and then all the things you learn, realize like, okay, I've passed all that on to my kiddos, and like that umbilical cord from mom to baby doesn't only pass on like nutrients and all that. It is like literally like the electrical cord from the brain to like their brain. Like passing on those, passing on those stress hormones, which we talk about a lot when we see pregnant patients in here. So not only when you come in for like pregnancy because you want to have an easier labor, delivery, maybe you're trying for that VBAC. Yeah, maybe you have sciatica, maybe you have ligament pain, pubic bone pain, all that's great, like a chiropractor can help with that, but we always try to get across like, hey, also it's really important to get adjusted because we affect your nervous system, and like you're under stress, baby's under stress, and we can calm that down.
Exactly.
And see that.
Yep.
So, yes, right. all those issues have in common is one, stress,
Mhm.
and then how that sympathetic nervous system can be stuck
Exactly.
on. Some would say it's stuck on and can't be in that parasympathetic growth repair.
So then we see issues like reflux, colic,
Mm-hmm.
constipation. That's what we see a lot in like infants and stuff, or like not being able to sleep, not being able
Yeah.
to wind down and stuff. And those are signs of like that sympathetic, like that gas pedal being stuck on. So like cinder block, gas pedal to the floor,
Yeah.
just like going. That is not how a baby should be.
Yeah, because their body doesn't even know how to digest or poop or sleep because that part of the nervous system isn't functioning properly right now. It's not.
Yeah.
Those nerves aren't firing. The nerves that are firing are the ones that are like survival, not a growth, repair, whatever.
Yep.
I was gonna say going from being pregnant, but also so maybe you had a stressful pregnancy, maybe you didn't. Maybe you're like the happiest person and there was no stress. Great, that's what we hope for your pregnancy. But sometimes the birthing process and labor can be very stressful or traumatic, and then baby comes into the world in like a traumatic labor, long labor, a lot of pushing, maybe forceps had to be used or a vacuum, or maybe it ended in emergency C-section. Mine did.
Yep.
Mine were C-section babies also, so already they got two like marks against them of like entering this world in a stressful situation and like things against them in this like perfect storm of things of like, okay, how maybe they are going to end up later on in life.
Yeah,
right?
Exactly.
So, boom, mom guilt right there. Like right there. All right, okay, I already messed them up from conception to birth.
But I mean,
But there are things you can do, like,
Yeah.
and a lot of parents don't know that. Like, we're not trying to put guilt on anyone because it's just the environment we live in. But there are things you can do to like decrease stress, and then things you can do to help baby early on, so hopefully they don't go throughout this pattern.
Exactly. That's why we're
Yeah.
not sharing this with anyone to make them feel guilty or like make them feel like shame for the birth process or
No.
anything like that. It's just we want to let you know that there's something different.
Yeah.
And that chiropractic care helps. I mean, we've seen that like with your kiddos and stuff like that. Your kids are never sick. They're like super healthy, no problems with development, and they have been adjusted since day one.
Yeah, Annie adjusted them in the hospital.
Yeah. And you were adjusted throughout your whole pregnancy too.
Yeah.
You carried them until 39 and a half weeks.
So they have been adjusted since day one. But it makes me wonder, like, what could have their life been if they weren't. Like, maybe I would have dealt with all those issues, which they did have some of them, but you adjust them and things improve.
Yeah, exactly.
Yeah, because actually, Maddie was pretty colicky, and they both had latching issues, and they never had ear infections. Yeah, but they did have that. But you adjust them and they move on, and hopefully we won't see these other issues. So what happens is, okay, stressful pregnancy 1, traumatic labor delivery 2, and then like I said, you end up with sleep issues, colic, reflux is a big one. And so then like parents don't know, they take them to the pediatrician, they get put on antibiotics or something for the reflux. Reflux. So you put them on a medication to like cover up that symptom. Great. Baby isn't spitting up anymore, but did it cover up the real reason why baby isn't spitting up? Or they're constipated, baby isn't pooping. You're told that's normal. They're gonna tell you like, hey, baby doesn't have to poop every day. Babies need to poop every day.
Breastfed babies can go a week without pooping.
Yeah, no.
According to a pediatrician.
We should all be pooping multiple times a day.
Even breastfed babies. They're not so efficient that they're just absorbing all the nutrients.
So
they still need to eliminate.
And then they're put on like Miralax or whatever, so they'll poop. So, but once again, their body isn't actually knowing what to do, and it's covering up another symptom.
Yeah.
Great. So then
down the road,
we're down the road now, and now maybe kiddo has some sensory issues.
We're getting chronic ear infections. Asymmetrical crawling.
Asymmetrical crawling, not crawling, or skipping crawling altogether.
Yeah, exactly.
Crawling is really important. It's part of development. There's a reason why your baby is developing the way they're developing. I was just listening to like a seminar, and they're talking about how the brain develops like front to back, down and up. Kind of just like how like your baby should be like on their belly, learn to put their head up, then roll to their back, and then like sit up, and then be able to crawl, and be able to pull. There's a reason why they're doing it. It's because it's the way their brain's developing. There's progression. It's the way their brain's developing. And so if they're not going in that order, okay, well then we know something's happening in their nervous system.
Or if they skip something, then that'll show up later.
Yeah.
Yeah, so then, okay, so we have then sensory issues.
Mm-hmm.
Those kiddos who have sensory issues then are often diagnosed with ADHD, like as soon as they're in school because
Yeah.
they can't sit still because
Yeah.
their sensory processing is
Yeah.
just off. Things are irritating to them.
Once
Their
again,
brains-
they're probably like gas pedal is on, so their brain is like, woo! Like,
Yeah, exactly. They're hyper processing everything that's going on.
Yeah.
Any information they're getting from their environment is like too much for them to handle, and it's overwhelming. So then they
Yeah.
act out and they get
Mm-hmm.
wiggly.
And then they get put on meds for that, which probably helps them in the school situation. But I know most kids on those meds don't like them. Like they will tell us, like they make me really tired. They make me not want to eat. They make, so it might be helping in the school
Most parents
situation.
don't like them.
No,
either.
parents don't want to give their kids meds if they don't have to.
No.
They're
don't
just
know what to do
trying
with their kids.
everything they know what to do and going to their pediatrician. This is what, or their schools are really like your kid has to be on this. Your kid has to be on this. And then we can also see like tics start to develop.
Yeah.
What else can we see?
I mean, allergies and
Allergies and
asthma.
asthma. Oh, yeah,
we
those
should
are
have put
huge.
those in the
Yeah,
list too.
allergies and asthma huge.
Yep.
So all of that, like if you're sitting here and you're like, oh yeah, my kid has, like maybe baby
You're
has those
checking
things.
boxes.
Yeah, or
Yeah.
like, oh my gosh, that is my kid now. Like they can't wear clothes with a tag because it's driving them crazy. They can't wear certain socks with a seam, or or noises. Like noises are really bothersome to them. That's a sensory thing.
Yeah.
Or maybe like as they're learning to eat, they won't eat certain food. Or now even as I don't know, a 5 to 7 year old, we're like, I don't know.
You know what else we see with a lot of
Texture.
this? Bedwetting too.
Oh yeah,
That's-
bedwetting.
yeah,
Huge. Yeah.
that goes along with a lot of these things
Yeah.
too. And it's not. I feel like parents often like bring kids in, and it's like we'll see a kid for sensory issues, and
Yeah.
we're like, okay, what about like bedwetting and stuff? And parents are like, oh yeah, I didn't.
Yeah.
Like I didn't tie those
Those
two
two
things
together,
together, but
yeah.
it's all
nervous system based.
exactly.
So
It's all that sympathetic nervous system.
But yeah, and the thing is, like it's not too late to get your kid help, like to get them under care. Like summer's the perfect time to do it because hopefully you have some time because you're not on such a schedule of like they're in school and then they're at this practice and then they're here and have to bring their sibling here and there. Hopefully you have like a little break where like it's a really great time to get them under care and when they can really heal, repair,
absolutely.
growth. Yeah.
And also, if you're an adult and you were like, I was checking those boxes for my child.
Yeah. Right.
We had somebody come in this week that was like, I had ear infections as a kid. I saw a chiropractor for them. I get this like that poor plumbing, like a lot of sinus, like tension and stuff like that. And he was like, I just know I need to get adjusted. And we were like, great.
Yeah.
Cool.
Yeah. So we also what's really cool in our office is we have like the way we see like how your child's nervous system is functioning is we have scans that tell us that reads like temperature differentials in the nervous system, like the vasomotor, the vasosensory, like tells us like where things are off, what's happening for the nervous system.
Yeah.
How
How
musculoskeletal
is the
system.
brain regulating things?
Yeah, how is the brain regulating things shows us exactly what's going on, and then like how severe it is too.
Yeah, exactly.
And the heart rate variability, it will tell us, is your kiddo stuck in the sympathetic
Yeah,
state?
is their gas pedal stuck on?
Yeah.
And that's an awesome tool, and it's cool because we get all the reports from the parents like in the beginning, and we do the test, and we're like, yes, this is exactly where I thought they would be on this scale, and then like it's never a surprise, basically. And then we go through care, we do a re-exam. Parents are, we see the changes on the scans, and parents also are reporting like, my kid's more social, my kid's like sleeping better, they're pooping better, they're they're less stressed out, less sensory stuff, like they're
can handle things better, anxiety, all those. I mean, kids have a lot of anxiety right now. And we use those scans to come up with like a plan that is individualized for your child.
Yeah.
Like it's not just based off of like random things, it's based off these scans and what's gonna work to get your kiddo nervous system functioning best.
Exactly. So we talk about this so much in the summer because kids are off of like their normal school schedules and stuff, and usually like the schedule like helps these kiddos like have some kind of like consistency. But when school's done, all that's kind of out the window.
Right.
They often have camps or like they have a bunch of, or they're at other people's houses, that kind of stuff. But care plan takes a couple of weeks typically to start seeing some changes, and so that's why we start talking about this at the end of the school year so much, because one, we're getting kids back on a consistent schedule, and two, then they are like ready to go into the new school year
right.
with a lot of these things taken care of.
Yeah.
Too, and a lot of changes happening. So that's why we offer. So we have like our kids like summer special. We're doing $50 new patient exams for kiddos all summer.
Yeah, all summer. It's
Because
like a
we
great
want to
time.
get those kids in because this is the time to start a care plan now,
Yes.
so that when we start school again in the fall, they're like ready to go back.
Yeah, and then
Yeah.
there may be more on a maintenance plan if
Mhm.
needed. So yes, kids, $50 all summer.
$50
New patient
Yep.
exam.
Teachers too.
Yeah, teachers, because also you know what, you hopefully have the summer off too.
Yeah. You need a reset.
You also need a reset.
Yep.
Yep. So if this sounds like your kiddo or someone maybe you know, or like yourself, like we said,
Mhm.
yeah, it's a good time to start. Here, message us.
Yeah.
Call us. Email is fine too.
Text
Text us.
us. Facebook messages,
Yeah.
Instagram messages. Get a hold of us through any channel. We're
You can
always-
actually
yeah.
text our number now.
Has it gone through?
Well, I mean that cell phone works. I text it.
You can text
You
our
can-
office number.
You can text us if you don't want to call us.
Yeah.
You can text our office number.
Wow, that's great.
Yeah.
I'm excited about that.
Yeah, you can do that. Probably
Yeah,
a great way
We
to get a hold of
upgraded.
us.
We got rid of the landline.
Yep.
So
Mm-hmm.
Yep.
2021 people.
I know. Moving into a new era.
New era.
Yep.
All right. Well, hopefully this helped some people. I don't know. Be like, maybe this is right for my kiddo.
Mm-hmm. I hope so.
I hope so. Or if you're pregnant, get under care early. That's important also.
That starts the whole process.
Starts the whole process, like
Mhm.
for you and for baby.
Bye bye.
Bye bye. All right. Enjoy your Wednesday.